Hi everybody, and this is Dr. Yoli. Happy Friday. So I want to share some stories about what we have seen this month, this couple of weeks. Very interesting case. We have had a wave of young people come, which is wonderful because I'm in shock of what I have seen in the young people. Rampant decay due to poor oral habits, perforations of the enamels into the inside of the teeth, hollow teeth, decay to the bone levels, people in their 20s with gum disease. So when you have decay that it has eroded the enamel and the dentin and is into the bone already, those teeth are hopeless. I had a young man, 25 years old. He came and with his wife, and he came because his wife insisted. He didn't want to be there. We had actually two young men that were brought by their wives. 5, 6 root canals, abscesses into the sinus, migraine headaches, bad odor in their mouth, gum disease, and usually you see somebody more in their 30s and 40s and 50s with a mouth like that. So speaking to them, I was trying to get to the bottom of how did this happen? How did you get to this point? One of them confessed that he loves Coca-Cola and he's addicted to Coca-Cola. So he drinks it in gallons and packs a day. So that explains part of the process. The other person, smoke, and smoking also burns the teeth, and then the teeth get damaged. And we had another young girl in her 20s, 29, 28. She suffered from asthma from childhood, and then she was put on albuterol and medications to suppress, it's a steroid, so it suppresses your immune system. So she developed gum disease because it dries your mouth. And she's losing actually some front teeth on the bottom, which are connected to the meridian of the kidneys. And she has been suffering urinary tract infection in kidney. And she came because at 29, she's afraid she's going to end up in dialysis. So these are real cases, people, young people very ill. So it's been said in the medical circles that this is the first generation that the parents are going to outlive their children. And that is horrific. I have a 20-year-old daughter, so I don't want to outlive my daughter. That is not the normal process of life. So I want to empower the young people to learn how can they be fully engaged and responsible in owning their health. I want to empower the young people to learn that soft drinks, Coca-Cola, anything that is acidic is going to damage the enamel, and you're going to damage your teeth. If you drink even water with lemon, use a straw, because it is good for you. But nothing with bubbles is going to be good for your mouth, because it's going to open the tubules of the enamel and the dentin, and then things are going to penetrate, the acid is going to erode. So there's a whole process of how do we keep our teeth fit. So fitness of your mouth is really important. So I am just so grateful that God is sending a lot of young people in their 20s that are learning or teaching them. This is so simple. This is what you do. Step 1, 2, 3, 4, and then for them to take action. Because if these things are left untreated and the actual habits don't change, and you don't learn and you don't own your health, this is a time in history that you have to own and be responsible. You don't get diabetes because you're working out, eating right, sleeping the hours, drinking water. doing all the things that you need to do properly. Most of the diabetic patients is caused by habits, by diet, and it's very simple to get diabetes. I'm from Puerto Rico, so the diets are rich in carbohydrates and fried foods. So all my uncles and aunts and cousins had diabetes, and only the people that decided to make a change in the diet and the habits were the ones that did not develop diabetes. So I know that we have to learn about what the food that you eat, greens, live foods. The closer the food is to the ground, meaning the grass, the fruits, vegetables, the healthier you're going to be. The more away from the ground, then it's going to have the toxins and all the pesticides and all these different things, are also a big problem. So our bodies are failing, and the functioning of our bodies are failing because the environment that we're putting our body, our mouth in, is not alkaline. So we have to be mindful of what we eat, what we drink, and I hope that I see you soon and I teach you individually and personally what is it that you need to do to be healthy. This is Dr. Yoli, and it was a beautiful Friday. God bless you.